And now let us go to South Wales and catch up with Jamie Jenkins, our favourite statistician. Jamie, very good afternoon to you.
Afternoon,
How
Mike.
are you doing, sir?
Yeah, not too bad. I think I'm one of the casualties of my teeth. I know you've been talking a lot
Yeah.
lately about teeth. I managed to see a dentist last week, but one of my fillings fell out during COVID and non-repairable, so they ripped it out last week. So
Oh,
a bit of pain there, but I managed to at least see a dentist,
well,
Mike.
at least you didn't have to rip it out yourself, which I think is what a lot of people have been reduced to doing. Don't get me started on trying to see a doctor though, because the BMA are amongst the people who are now saying, "Oh, we must be very careful, cautious." These are the same people who won't see patients in their surgeries in case they catch COVID.
Yeah, well, but some of the stats, Mike, the impact of that is quite dramatic actually, because people not being able to see the GP has actually meant that I think Cancer Research UK, and I've been talking about them separately this morning, but for Cancer Research UK, they did some analysis of the number of people who probably haven't been forward for screening programs or been
Yes.
referred by their GP for things like cancer. And one of the remarkable stats over the last year, Mike, if you just look at England alone, we would probably expect about 315,000 people a year to start treatment for
Mm.
cancer, but it was 40,000 less in the last year. So there's that missing 40,000 people who are probably sadly have cancer at the moment that
Yes.
hadn't started treatment because they may not have even A, found out that they've got it, or B, kind of the services have been so slow they haven't even started the treatment. And there's all these wider things,
Mm.
Mike, that we talked about before with the National Health Service. Well, it's been more the National COVID Service for the last 12 months.
Well, it
And
has,
there's
and
all these
and
other
to,
things
and, and
creeping
to
in.
the and to the detriment of an awful lot of things, not simply cancer and what you might regard as other diseases, but things like mental health as well, which you raised on your Twitter account yesterday.
Yeah, so the ONS kind of do a survey of people across Britain, and what they do there is they ask them if they're suffering from, say, what you would class as depressive symptoms. So
Yeah.
it's not a formal diagnosis of a mental health issue, but it's coming straight from the people now. Before the pandemic, it was around 1 in 10 people were reporting
Mm.
this. But they did the recent numbers lately, and it's more than doubled now. It's just
Mm.
about 1 in 5. And if you actually multiply that percentage then up by the population, there could be over 10 million people, Mike, in the UK at the moment who've got kind of a mental health issue. And there was a story, it's not really covered much in the mainstream media, but there was a story that ITV actually did cover a few weeks ago that in the northwest of England, where we've seen this rise of cases in the Indian variant, the number of people, the patients who've got mental health issues, all the beds are full.
Yeah.
And we're seeing what we're across most of the health system across the country is more and more people going into hospital now. So we've got more patients, and now in parts of the country, in particular Wales, as I've been looking at in particular
Mm.
there, more patients in hospital than we had at the height of the pandemic
Yeah.
in wave two, because people are going to visit because they were too scared to go beforehand. But the problem we're now having is that people are saying that, well, we can need to continue with restrictions in case more people go to the NHS because of COVID. But
Right. Well, this
ultimately,
is the thing. I
you've
mean,
got
I
to
was
treat
hearing
them.
somebody making an argument the other day saying, oh, well, we have to be careful now because the hospitals are starting to fill up again with people who weren't treated before because of COVID. And now they're coming in to get treatment and we're giving them beds. And, we might be overwhelmed if we're not careful. And it's like, well, hang on a minute. The health service is there to help sick people. If it hasn't got the capacity for helping sick people, maybe it's the case that they're still social distancing the beds or something. I don't even know. But surely we can't keep lockdown because the hospital system is inadequate and inefficient.
Well, part of this, Mike, is going to be kind of decades of underfunding from different governments, from different parties, except, you've got Conservatives in England, you've got Wales running it,
Mm.
you've got the Tories there, Labour running it in Wales. So there's going to be lots of different factors at play. But I think, if you just look at the data, Mike, as well, in terms of A&E
Mm.
attendances. So in England, you would normally get, before the pandemic, around 2 million people a month rocking up at A&E. Now, after a month into the pandemic last year in April, that fell below 1 million. So
Right.
there's a million people who just didn't turn up an accident and emergency. It's been creeping back up, which is obviously good that people are seeking
Mm.
out healthcare if they need it. It's still about 200,000 patients below. Some people would argue, Mike, that maybe it was too high anyway, and people were going to A&E when they didn't actually have an accident or an emergency, and they were going there because they couldn't get treatment elsewhere. But there are patients missing all over the system, and waiting lists are going up.
Mm.
And going back to your story, Mike, that you've been running for a few weeks about GP
Yeah.
diagnosis. Well, waiting lists have gone up. But remember, a lot of patients haven't even been in to see their GP the last year. So there's a lot of undiagnosed health problems in the country. So you think if waiting lists are over 5 million in England now, 500,000 in Wales, if they do get to the point where you get to see your GP and they diagnose you, it's going to go up even more. So
Mm.
we've got to start factoring in, Mike, that we've got this vaccine rollout. We've got nearly half of England have had 2 doses of the vaccine, of adults, that is. 3/4 across the country have had 1 dose at least. So we've backed the vaccine. Deaths are really low. And on those statistics, Mike, I think the important one to focus on is the number of deaths for the time of year compared to the average. And it's been below average now for over 2.5 months.
Yeah.
And if you take the period from March up to, say, May now, about 7.5% below average. There's more deaths in April from flu and pneumonia than there was from COVID.
Yeah. Well, this is it. And I mean, they've now had the Indian variant since about the beginning of April. So quite a substantial amount of time to be able to study what it's doing. The idea that they're now saying somehow cases are going up by 28%, today's figure is, or they've gone up double since the last time we measured them last week. You know, I mean, it doesn't really quite ring true. And what we also know is that all the people in hospital in the north of England because of COVID are people who have not been vaccinated, whether they've chosen not to be vaccinated or whether they're too young to have been vaccinated. What we do know is if you have been vaccinated, there's a very low risk that you're going to have a problem.
Yeah, so if we look at the Indian variant in a bit more detail, I think what some of the models do predict, Mike, and maybe the models are broken now, or we weren't a big fan of them before, but what you would see is that you start seeing a rise in cases, and then if they keep doubling and doubling and doubling, then you get these really scary numbers that we've seen on some of the government briefings over the past year or so. Yeah. We have seen an increase over the last year, but what the main headlines don't tell you is the majority of that increase has actually been among younger people. So if you look at the cases in England, say over the last 7 days, around a third of them are for people under the age of 20, and about half of them are for people under the age of 25. And we know these are less likely to lead to serious illnesses. Now, the concern people have, which is why we say, well, we need to stop these people mixing, is that it leads to wider community transmission, and then you start passing it on to older people. So I've looked at the older age group as well. Now, at the height of the pandemic in wave 2 in January, about 10% of all the cases coming back, Mike, were over the age of 70. And the reason I've chosen that age group is, remember, 83% of all these deaths have been people over the age of 70. So it's about 10% in January. It's falling every single week now, and it's down to 2.3%. So in the last 7 days, 300 people have been diagnosed with COVID through the system of testing over the age of 70. In the 7-day period, it was 35,000, Mike, when you go back. And remember, in January, they didn't have the vaccine. So the 300 people now have had the vaccine, which is what you said. The NHS bosses are saying they're not seeing people going into hospital having serious illnesses leading into intensive care. So the break between kind of cases and looking at cases and then seeing deaths is clearly there. So I think people saying we need to take a whole look at the data, etc. I don't know what data they're waiting for, Mike, because the vaccine companies have said that this variant, the vaccines work against, and the vaccines are far more potent and better than flu vaccines are.
Yeah. Well, they are. We know that because we know that they are far more effective. But, you know, again, looking at the stories in the papers today, called to delay reopening amid a fear of the third wave. And these are scientists, right? Professor Ravi Gupta being one of them, who's a member of NerveTag, I think, you know, saying, oh, there's a big danger that, you know, we're going to get a third wave and it could be worse than the second wave. And you're kind of going, where are you getting all this from? You know, because it doesn't make any sense. Why are they continuing to put the fear of God into people to say, you know, we may effectively what they're saying, we may never get out of this?
Well, there's two things, Mike, that you need to bring together on this. The constant fear of different waves will fuel that mental health issue that we were just talking about. So no wonder people are kind of scared. A recent ONS survey has shown as well, Mike, that despite the shielding restrictions being eased, there are just as many patients shielding now as they were before. And then you turn on the TV or the radio, there are constant reminders from government, about getting vaccines or stay safe, etc. So people are scared out there, and think they've tried this over the last year of using a lot of scare tactics. And at times maybe that's been the right thing, but who knows? But at the moment, the case is really low. I plot a map on my Twitter profile that looks at case rates across the country. There are these hotspots in the north of England, in the northwest, but they are generally among younger people. Yeah, we've had outbreaks in Wales, Mike, where we've seen kind of schools closing because we've seen an outbreak. But the good thing there, I've tracked them in, say, South Wales and Newport and Cardiff, is that about a week after, they haven't gone out wide into the community, they've come back down. So I think it's a bit early to be starting to worry about the whole of the UK, or say England in particular needs to ease back on back on restrictions because of rising cases in the northwest. We've looked at data and dates. We've talked about that before, Mike. I don't think they've been following data or dates.
No.
The June the 21st has kind of come out because Boris Johnson said several months ago we'll have everything aimed and ended by June the 21st. But on the whole, they haven't been following data and dates because some of the restrictions haven't been warranted. You look at the wedding industry that you've been talking about. Well, it's devastating for people.
Well, of course it is. And I mean, when you look at some of the stuff that Gupta has actually said, it will probably take longer than earlier waves to emerge because of the fact that we do have quite high levels of vaccination in the population. So there may be a false sense of security. Well, hang on. I mean, the whole point of that means that the reason that people are not getting infected as much is because they're vaccinated. Why would that change, in 3 months' time? Because they'll still be vaccinated and they still won't be getting the disease, surely.
Well, I think with these vaccines, Mike, I was looking on the World Health Organization website this morning, and so what they say is a flu vaccine is about 40 to 60% effective. And we know people sadly die from the flu. And we saw a big rise in deaths around 2018-19 because the vaccine that was rolled out that year wasn't as potent as what it would have been in a normal year. And the latest year, Mike, they've even got names for these flu variants. So the latest flu vaccine has been designed to combat an Hawaiian variant, an Hong Kong variant, a Washington variant. So they change the flu vaccine all the time. So we're going to constantly see different variants. Yeah. But if we'd been monitoring, Mike, this is what I think, if we'd been testing people for the last 30 years for the flu, and we had the same kind of scientists and this daily kind of media looking at the latest cases, we probably would have been shutting down every winter for the last 30 years, shutting the economy down. But we've got to learn to live with it. And as you're right, we've got majority of the people with antibodies. We will see a third wave of cases probably, Mike. And when I say that, we will see a rise in cases because whilst the vaccine reduces transmission, it doesn't get rid of it all completely. But we should stop looking at cases and plotting these and look more on the hospitalizations and the deaths. And as I say, talk of a third wave when deaths have been below average for 2.5 months is a bit premature and it's a bit kind of irresponsible in terms of, I think, when you're looking in terms of people's mental health and scaring. And we know, Mike, that over kind of 700,000 people, approaching 800,000 people, have lost jobs over the last year.
Well, that's it. And when people like Professor Gupta say, let's give it another couple of months is the difference between life and death for an awful lot of businesses. They can't reopen, like wedding businesses, event businesses, nightclubs, music businesses, all sorts of hospitality, who are still only really grimly hanging on because they still can't get back to normal in terms of getting all the people they want into a particular restaurant or into a particular bar. There's still, room for improvement in terms of what they can do. And as I said yesterday, I was out and about Saturday and Sunday in London, and Monday as well. And quite frankly, it was absolutely rammed. It was almost as though the lockdown is no longer a thing. I don't know what it was like in Wales, but certainly the beaches are all full of people. The parks are all full of people. Nobody seems to be wearing masks as much as they used to be. And surely if there was ever going to be something to go wrong, it would be sort of now.
Yeah, and if you remember, Mike, we saw a massive drop in cases last year. We had that first wave throughout the summer. We had that Eat Out to Help Out scheme, which I don't think dramatically pushed up the virus.
Nothing changed. I mean, the only time it changed was when they sent all the kids back to school in September and all the university students back to their universities. That was when the spike came.
Yeah, so it's 2 weeks into September, we started seeing the spike. And the issue we had there then, Mike, was that they were then mixing more in the community, and then older people were catching the virus. It was going into care homes through staff and into hospitals. But the majority of people are vaccinated now. And you bang on. So if you say, let's wait another 2 months, well, in 2 months' time, we'll be talking about a different variant from another part of the world. Right. Because this is a virus that mutates and will continue to mutate. So we could just put this off forever. We could just be in 2025 talking about, well, let's just wait another 2 months.
Yeah,
because
and here's the thing for you, right? They're talking about the Vietnamese variant now, right? Now, by a complete and utter coincidence, I was watching a report this morning from an MP down on Dover's coast, where a lot of people are coming in on the migrant boats, and a lot of the people that they're seeing at the moment are coming in are young, unaccompanied women, many of them from Vietnam. Now, I'm not saying the two things are connected, but it's worth looking into, isn't it?
Well, one of the problems you've got with obviously all the migrants coming in via boats, they're not going to be socially distancing as they come in. And it's a very difficult thing. You would hope that people, even if they're coming in via these illegal routes, Mike, but they are being tested and being isolated. So I don't know exactly what's going on there.
But maybe that's where they're finding the Vietnam variant, and they're testing them and they're finding it, and they're going, now we've got a variant from Vietnam. Guess why? Somebody just came in from Vietnam with COVID.
Well, the thing is, Mike, we keep looking for different variants and we keep testing loads of different people. I'm
Right.
staggered by the amount of testing that's continuing to go on
Well,
because the
yeah, I
number
mean,
of
the school kids are all still being told that when you're off on half term, make sure you test yourself twice a week. I mean, it's madness.
No, I've been quite critical of these lateral flow tests of the children who keep getting, Mike, because, I think we'd be far better spending the money on trying to, my children haven't seen a dentist for over a year. So
Mm.
I'd rather get more kind of dental treatment going on, which is
Well, as
other
as
sort.
we speak, right, a mate of mine has sent me a picture of a tooth that he's just pulled out of his own head because he said,
Oh,
I've just done exactly what you've described. Incredible.
no, and I think, Mike, it doesn't help in terms of you guys have been covering it quite well in terms of talk radio, in terms of the wider harms,
Mm.
because ultimately there was a story I saw on the BBC News the other evening where they were saying in an emergency, only phone 999 in an emergency. Well, I thought, well, hang on now. I'm sure that's always been the case. You should only phone
Well, it's
999
like,
in an
but it's
emergency.
like the BMA saying to me, we'd rather you didn't come to the doctor's surgery if you're not well. You kind of go, sorry, isn't that what you're supposed to do?
Well, yeah, and I think part of the problem we've got, Mike, is that, and you've been covering it on the show for several months now, is the opposition party as well, in terms of who's putting any opposition on the government, because there is no opposition on the government. So Keir Starmer, what's his view? And I was looking at the data just as a side point in terms of the politics,
Mm.
Mike, as well. So obviously Labour are losing ground in the north. But the Lib Dems in some of the Remain areas of the south of England are picking up some seats
Yeah.
from the Tories in the council elections. But where are the Lib Dems in all of this as well? I don't even know who the Lib Dem leader is these
Well,
days.
it's gone to Sir Ed Davey. But I mean, here's another guy that you might as well never have heard of because he never speaks, never says anything. He occasionally gets up during Prime Minister's questions when he gets a question to ask. But there's so few of them now that they've got no sort of they've got no kind of weight to bring to any argument. And the last time I heard him say anything about policy, they did actually go anti-lockdown before the election, but nobody really noticed.
Right, yeah, and I think that's a big problem, Mike, that we've got at the moment is this lack of opposition against all the kind of the restrictions that are
Yeah.
in place. And who's running the country? Because ultimately, you vote politicians in to make policy decisions. So the government of the day, whether it's in Scotland, Northern Ireland, Wales, or England, should be taking the decisions. But it seems to be that they've been delegated the responsibilities down to Sage in England, and and they've just been constantly kind of scaremongering and worrying. But you've got to look at the cost of all of this, Mike. So the testing, the kind of the economic harm and all of this, the money doesn't grow on trees. This money has to be paid back from somewhere. And ultimately it's going to be our children who are going to have to be paying this back. And it's just a travesty, Mike, especially when deaths have been below average for, like, say, 2.5 months. We've got this huge impact on mental health. We've got waiting lists that are continuing to grow. We've got GPs who haven't been diagnosing people, which will probably increase the waiting lists even further. Fewer people are going into A&E. And another sad statistic, Mike, is that if you look at the last year, we talk about deaths above average. Well, deaths have been above average in people's homes for the last year as well. So people have been too scared to go to hospital, and that's probably led to a lot of deaths as well.
Yeah, I wouldn't be at all surprised. Jamie, great to talk to you again. Thank you very much indeed. Jamie Jenkins, former head of health analysis at the Office for National Statistics, the ONS. He's our favourite statistician because what he does is he just cuts straight to the chase and basically tells us what is really going on. And the idea that somehow we're supposed to delay the reopening on June the 21st just because somebody from Sage thinks that there's a third wave coming without any evidence whatsoever. I mean, to say this, right, that we've got quite high levels of vaccination in the population, but that may have created a false sense of security. Well, how's it a false sense of security? If you're vaccinated, you're very, very unlikely to get ill. They know that. They've said that. So what on earth is this Gupta person going on about? This is Talk Radio.